Hello, Francesca. How are you? I want to show you something uh, regarding your case. As you know, we're off to a good start. You've been wearing aligners for about 5 or 6 months, and the alignment of your teeth is almost spot on. We have some minor rotation left of this tooth. I also would like to slightly widen the arc of your smile because you had two teeth removed when you were younger with braces. Now we have to accept that you have two less teeth, and so we can't widen it too much. But I can widen it a little bit. And I noticed something about one of your teeth that I want to share with you because it relates to the orthodontics. If you look at this premolar here, you have a filling on this tooth. You may not be able to see the filling super clearly, but I recognize it. There's this ridge here that looks almost, I wouldn't say unnatural, but the anatomy is a little bit flat without like what we call fossa or lines or occlusal anatomy, we call it. So this looks like a filling. And this has a certain width, and that's fine. But look over here. This tooth, same tooth, it should be the same width, but it's definitely skinnier. And I don't know if anything was done to it, but this looks unnatural. There's sort of a defect or a ridge right over here. I didn't notice this until I really looked at your scan now in refinement. And so my idea, and we could see what your dentist says, is we've chosen not to rotate this tooth because you have all three molars, and that's just not very practical. And I'm sure you're coping with this. Let me know if you are trapping food, but I don't think the tooth looks super healthy here. And it's tough to put a filling here. But while I expand, if I were to just add a little space there, then you see this. If I can do this, then you could get a beautiful filling and the dentist would have more access, maybe even a crown to reinforce that. So let me have the name of your dentist. I'll send them this very video and then we'll see if they would like to do this. And of course, you would have to then commit after I do this to having that space filled, which at the same time would reinforce the defect on this tooth.